Trauma is still a worldwide problem, and it affects mainly young persons up to an age of 45. That means in former days our youth died on the battlefields in Europe, and nowadays they are dying on our streets. But lethality rates in the world are different, depending on many things and parameters. For example, the development status of the country, the medical infrastructure, access to treatment and resources, as well as level of care or staff competence. Even in Germany, in one of the highest developed countries in the world, the mortality rate after the reunification in the early 90s was about 20%. And this seemed to be an intolerable situation for one of the highest developed countries in the world. Therefore, trauma specialists focused their interest on the idea how to improve this situation. And the first step was to analyze the situation. That means they founded a register where all data about trauma patients were collected. And out of these data, they took the source for improvements to improve the situation. In a second step, they tried to organize trauma care in so-called networks. That means hospitals of different levels of care cooperate inside a certain region in order to standardize the treatment of these patients. And doing this over more than 25 years now, we were able to standardize the treatment in Germany at all times and in all places nationwide. But in the end of the day, this only led to an improvement in survival of 2 to 4%. But as you know, every single life counts, because it mainly affects young persons. Thank you.